Hey guys, what's up? Damn man, this is some ghetto production. So pretty much just ghetto production. Anyway, just a very quick video, as always, about how I dealt with my joint pain. I had very bad joint pain in my left elbow and in my right, but left was just terrible. From tricep movements or exercises. And recently, had in my left knee, very bad, inner knee pain. And this is, keep in mind, this is box squats. Like, this is very wide stance. And it's a box squat to relieve the pressure on your knee. But even then, I still had inner knee pain, which is kind of scary. Because if it's outer knee pain, it's mostly likely just, how'd you say it? Like a ligament is a bit not inflamed, right? Tendinitis, basically, which is fine. You just, I mean, it's not gonna kill you. But if you have inner knee pain, that could be something bad. Anyway, long story short, I solved the problem with my knee pain and my elbow pain, and it is obviously it is thanks to Alpha Destiny. I know, like, this whole channel is like a whole just big shout out to Alpha. Like, my whole channel is just dedicated to him. It's not, but I have to admit it. I mean, a lot of the good advice has come from him. Anyway, honestly, it's such a simple way to get the pain away, warming up. But thing is, people don't understand what we mean when we say warm up. They don't understand. Let me tell you what I mean by warm up. When I do overhead extensions, right? Firstly, let me tell you something. My elbow pain and elbow like stiffness was so bad before that I even doing, like, never forget skull crushers, forget overhead extensions, even doing push downs, yeah, would hurt my elbow sometimes. Imagine if I did heavy push downs, like 10 reps, 12 reps, it would hurt my elbow. Imagine that. Like, imagine how bad my elbow inflammation was. So what do I do now? I go in the gym. Before I do the overhead extensions, I warm up literally for about 10 minutes, 5 to 10 minutes. What I'll do is I'll get a band. It's a lightest band. I mean, it's like 15 pounds of tension. And I do really quick, like Alex does, Alpha Destiny does. I do it really quick for like lightweight for like I'll do like 80 reps, like non-stop, and then I'm getting tired, right, to failure. Then I'll give like 20-second break, then 60 reps, 20-second break, then 40 reps, and I'll just do it until I'm getting to like really low reps, and then I'll get like a half a minute rest. So I'm already like 4 minutes in. Then I'll chill for like half a minute. Then I'll start doing slow and controlled and really squeezing, getting as much blood, into that area as possible. And that pretty much does it. And then on top of that, then when I actually go, I get the easy curl bar, the one you do overhead extension. I get that, and I'll do 15 reps, like 3 or 4 sets, 15 reps with just the bar, like this, really fast, like this. And also I'll do this. I'll bring it down. Like, again, this is from Alex's advice. I won't do this. I won't do that. I'll go like this. I'll ease it back to get the tension off the elbow. So, boom, boom, boom. Like, look at the difference. This is not how I do it. Okay, this is how I do it. Back, up. This is not how I do it. You see that? I get the tension off the elbows, and then I push back up. Anyway, that's that. In terms of knee pain, I was very worried about it because, as I said, it was inner knee pain. It was inside, like under the kneecap, and that can be quite bad. That can be a sign of something, bad going on. So I was very worried about that because squatting is like the main, like, probably squatting and deadlifting are the two main mass builders. Period. Like, there's nothing that builds more mass than squatting and deadlifting, in my opinion. Obviously, especially for the lower body, but in general, maybe deadlifting beats the squat. But anyway, squatting is just that badass exercise that you're putting weight on your back. I like deadlifting a lot, but I've realized recently squatting is where it's at. Squatting is like You know why? Because if you have weight on your back and you're going down, it's like you've got to come back up. You know, obviously, technically, you can't throw it off your back. Well, not in my gym. Mine is not like a hardcore gym. It's not like a powerlifting or weightlifting gym. But if you deadlift, you just drop it. That's it. But with the squat, you got to come back up. So anyway, not getting off topic. How I dealt with it? Simple. Again, very simple. Leg extensions and leg curls. What I'll do 20 reps, very lightweight, you know, pretty lightweight. 20 reps, then I'll go straight to the leg curl. Leg curl, I mean like the one where you go like this. You're not lying on your stomach, you just sit there and then you know, it's like a hamstring movement. Then I'll do the same, 20 reps. Then I'll go back to non-stop, no rest. Go back to the leg extension, 20 reps, and I'll do about 5 or 6 sets. And I really, by the end, it's always at the end when I'm starting to get tired, then I start to really try and squeeze it, get as much blood in there as possible. Then I go to the squats. I do about 2 to 3, minimum 2 sets with just the bar. Then I'll go into, 75 pounds, what is it, 75 pounds? Anyway, I don't know about pounds. I'll do, excuse me, that was rude. Just the bar, 2 or 3 sets. Then I'll do 1 set with just 40 kilos, including the bar, obviously. Then I'll do another set with 60 kilos, which is 135. Then I'll do another set with 80 kilos. Then I'll get to my working set. There you go. So that's how I deal with my pain. And it works. Obviously, there may be something else going on, and this won't help you for that. So you have to see a doctor or see a specialist about that. My advice, honestly, is don't. I mean, I don't know how it is. Maybe you live in the U.S. I live in the U.K. And these general practitioners, GPs, the doctors. When you have a problem, you're not sure what it is, you go to them, and then they refer you to a specialist. They're pretty useless when it comes to joint pain and things like that. They don't know a lot. I know more than them in a lot of ways when it comes to joint pain, when it comes to, things like that. And as a testament, I actually saw my GP in the gym with one of these useless personal trainers, and he's using bad form. Anyway, whatever. I'm not going to get into that. But anyway, there you go. That's how you cure your, that's a very simple way. The reason I made this video is because it's so simple. People don't think about it, including myself. I actually never thought about this before, because I was ignorant. So there you go, warm up intensely. And if you're not going to be patient and warm up properly, don't complain about, the joint pain. Give it a try. If it still doesn't work, then go and see a specialist. There you go.